Right, so you have a patient who's currently an inpatient, is met from the GP with ascites. We've done a peritoneal tap for them, and it showed some malignant cells in cytology. The tumor markers were sent. We don't have the results yet, and the patient is being planned for CT abdomen pelvis, but CT is broken at the moment, and it will not be fixed until after the weekend, and today is Friday. The radiologist offered to do an ultrasound and instead of the CT scan. And the consultant was supposed to speak with the wife, but he had an emergency and went to the operating theatre. And the registrar wrote in the notes that if the patient develops shortness of breath, we can consider a therapeutic tap of the ascites. Your task is to update the patient's wife with the above information. Of course, in the STEM, you will not have all of these information, which I just mentioned, but this will be available in the patient notes. So the STEM will usually say, update the patient wife or the patient son or whatever about the patient current condition, and you'll have to go through the notes and read everything, but these are the summary of the findings. Ideally, and I think I mentioned this in the lecture if we watched it, ideally you should be memorizing these data. I know it sounds a little bit weird to memorize these because they are not particularly medical, but it helps in the exam. That will make the preparation scenario much easier for you. So we'll just be going to the preparation room and checking very quickly what are the adequate information that you need to say. All right, so anyways, so Amna, could you please update the patient, let's call it son, about his current condition?
So I'll start now. Hi,
Please.
good morning.
Hi, good morning.
Hi, good.
Are
I'm
you
one of.
Mr. Mann? Sorry, I'm looking to speak with Mr. Mann. I've been waiting for
No,
all to speak with them,
no,
basically.
no. I'm Dr. Atwal, one of the registrar working with Mr. Mann. And unfortunately, Mr. Mann is not available as he's busy with one of the emergency surgeries. And I'm here to answer all your questions, and whatever you want, you can ask me about the situation. Can you confirm?
All right, yeah, that's fine. Thanks for coming to see me.
Can you confirm your name and your relationship with the patient, please?
Yeah, I'm Abdullah. I'm his son.
All right, Mr. Abdullah. So, first of all, I would like to know that what all do you know about the condition of your father?
Well, not much really. I'm just here to be updated. All I know that the GP referred my father with some sort of fluid accumulation in his tummy, but I'm not updated since really.
Uh, all right, I'll update you about the condition of your father, and just wanted to know that what all do you know about your father, so we can just be on the same page. So, about your father's condition, as you have mentioned, yes, he came to us 2 days back with pain in his tummy, and for that we did some investigations and we took a fluid out of the tummy. We sent it for investigations, which came out to have some nasty cells in that, and that's further
With
gone
nasty cells? What do you mean by nasty cells?
I'm sorry to inform you that, but that could be cancer cells, and we need to confirm it because
Oh.
it's for further investigations. I'm really sorry to
Hmm.
inform you about that. But we don't have a final diagnosis as of now, and for that we need to do a
So,
CT.
doctor, hold on, hold on. I'm just a bit. This is a lot to take in, really. So you're saying that my father has cancer? Is that what you're saying?
I'm so sorry to inform you that, but we need further investigations to come to a final diagnosis. But yes, there are some cells which could
So
take us
what type of cancer is that? Is it liver cancer or bowel cancer? What kind of cancer is it?
at this point of time. I'm not sure about it, and for that, in order to see what type of cancer, we are doing a
What do
CT
you mean you're
scan
not sure? But you just said it's cancer, isn't it?
because the cells show that there is some doubt about it, and we need to confirm that.
I'm not really sure if this is clear to me, doctor. It's either patient has cancer or don't have cancer. I'm not sure if I understand what you're saying.
Okay, I'll try to explain this to you again. This We took a fluid out of your father's tummy that shows some cells which are cancer cells, and from originally it is coming and what type of cancer your father has, we need to investigate more about it. And for that, we're going to do further investigations, CT scan for that, which is one of those. Yes. Am
Okay,
I?
fine. So you're saying that we're gonna get a CT scan to
Yes.
find out what is the source of that cancer cells that you mentioned. Is that
Yes.
correct?
Yes.
Okay. When are we getting the CT scan? We're getting it done today?
Unfortunately, the CT scan machine is not working, and it's gone for the repair, and it would take this weekend. So we'll be able to
I
do
don't get
this.
it, doctor. What kind of hospital is this? So now you're saying that, so you were not sure if it's cancer or not, and the way you explain it seems that it's really urgent, and now you're saying that the CT scan is not working. What kind of hospital is this? Is this
Sorry,
even a hospital that's offering service to patients?
I'm sorry about the situation in a hospital, but usually, in a situation like this, it takes 2 weeks to get a CT scan done. And if anything urgent is required, we would definitely do
I
what
don't get
can.
it really. So you're saying that my father is probably have cancer and is going to stay inpatient for 2 weeks until we're able to do a CT scan for them. And
That
he's
is what
really
is.
depressed and he's severe pain. So just, I don't know. I don't see that you're actually doing anything. Can you transfer him to a different hospital, please?
Uh, I'm so sorry, Mr. Abdullah, but I'll just try to explain this to you. For a normal patient, it takes, for any like situation like this, it's 2 weeks that we consider for doing a CT scan, and it is nothing which is urgent as of now. And if anything that is not in our hands or that requires a patient,
So you think this is not urgent. So what do you say? I'm sorry to interrupt you, but you think this is not urgent. So what do you think about his shortness of breath and he's in severe pain? Is that urgent to you or not?
yes, exactly. That is urgent to you, and that would be taken care of as soon as possible. And for the shortness of breath, we have planned a therapeutic tap. That is, the fluid would be taken out, more fluid would be taken out to
What is a
relieve the.
therapeutic tap?
Okay, that will remove the excessive amount of fluid from the tummy, so it would relieve his lungs, and he uh, would relieve his shortness of breath, and we add some painkillers.
Do
So
you think that
he
the cause of his shortness of breath is the pressure from the fluid in his stomach? Is that what you're
Yes,
saying?
this is something that I think is one of the main reason, but I'll have a look in the charts and I will see if there is any other cause of that.
Okay, fine. All right. Well, I mean, the way I'm thinking about it is that I would like to know if you told me now that my father has cancer cells, I would like to know as soon as I can what kind of cancer is it and whether there's anything that we can do about it urgently. So, are you able to offer him maybe any alternative scan that you can do, or even transfer him to a different hospital because he didn't answer this question yet to me? Can we
Uh,
just send him to a different hospital that has a scanner that's working?
I understand your concern completely, Mr. Abdullah. The alternates that we can go for is ultrasound scan and an MRI scan that is of similar importance. And
And
I'll
these are
talk.
working, right?
Yes, I'll talk to Mr.
So
Mann about.
MRI is working at the moment, right?
Yes, MRI is working, and I'll discuss this with Mr. Mann if we can go
And
for
you will
this.
be able to get it over the weekend because today is Friday and is MRI working in the weekend?
I'll have to confirm it with the radiology team and with Mr. Mann. I cannot assure you for that as of now, but I will try to do
Okay,
what is in the best interest of the patient.
that's fine.
Any other questions you would like to ask?
Yeah, I mean, lots of questions really. Do I need to speak with my family? I have my brother lives like 500 miles away, and do you think I need to speak with him to ask him to come in?
I understand your concern completely, but I would advise you that till the time we have the final diagnosis in our hands and we get the further investigations done, if that's possible for you, I would advise you
Yeah.
to till then.
So is he going to have surgery?
At this point of time, it's difficult for me to say if surgery is required or not. Once we get all the investigations done, we have final diagnosis, and we get to know at what stage the disease is, and it will be discussed by a multidisciplinary team, and we'll inform you and we'll discuss all the treatment options with you and we'll update you about it.
Okay. Fine. Yeah. Okay. You said about the short-term spread that you're going to do something like a tab for him. Is that correct?
Yes, yes. As I've
Okay.
mentioned you before, that's I've seen in the notes that we're going to do a therapeutic tap. That means the excessive fluid we're going to remove from the tummy.
Sure. All right. Okay. Thank you.
Thank you so much, Mr. Abdullah. If any other questions you have, I'll give my number to the nurse at the reception. You can just get back to me, and any queries, I'll be happy to help. Thank you so much.
Sure. Thank you. All right. So Amna, what do you think? What do you think of your performance?
In the beginning, I just got confused and I just some hodgepodge things in the beginning.
Yeah. Yeah. Anything else? What have you done well that you think? What's the best thing that you think you did in this scenario?
I was trying to answer all the queries of patient and was trying to satisfy him, and I just tried
Yeah.
my best to do that.
Yeah. That's right. And what can you improve next time?
Uh, I don't know. So many things to be improved.
Okay. Yeah, that's fine. No worries. I'm gonna tell you what to improve then. So I'm sorry if I was a little bit silly during the scenario, but this is actually how it is in the exam. So they're gonna interrupt you quite a lot. They're gonna speak quite a lot, and your role is to reassure, listen to them, and then start answering their questions nicely. Okay. So I'll tell you what has gone not particularly wrong, but what can be improved next time. I think your start was good. You started by, despite I tried to confuse you and say, "Are you Mr. Man?" or "Are you the consultant?" I'm trying to find whoever the consultant. Of course, Mr. Man is a man, so I'm not going to say this to a female doctor, but they can just say, "Are you the consultant? I'm looking to speak to the consultant," and this is the time that you need to present yourself or introduce yourself and uh, uh, correct them that no, I'm not the consultant. I'm one of the SHOs. That I'm here to speak with you because the consultant is busy, which you have done so, which is really good. Because sometimes people just would ignore introducing themselves. So that's a good thing that you did. All right. So in terms of you established background and you try to find out what kind of knowledge do I have about the case, which again is a good thing. And then I said, well, I know that they have some fluid accumulation in their tummy. And then you started going into cancer. That was quite, that's the thing that needs to be improved. I wouldn't say it very like directly to the patient. I would try to reassure them first and try to sort of like give them the adequate information. So the way I would say, I'll say, well, your father came in 2 days ago, as you know, by a tummy pain from the GP. We've done some investigation for him and we found that has fluid accumulation in the tummy, as you said. So in this condition, there are multiple reasons for it. So we need to do further investigation to find out what has caused it. It could be from the liver, it could be from multiple other reasons, such as, for example, reasons as serious as cancer. But most of the time, it's medical reasons. So in your father's condition, we've done some investigations, we've sent some samples, and unfortunately, there is some cancer cells in the fluid. It doesn't mean that he has cancer just yet. We need to find out what's the primary source, and we don't know that at the moment. So I wouldn't rush and say that this is definitely cancer, but it's likely, and I would like to get further tests, including CT abdomen and pelvis, and some other imaging, and then see how they take that. So when you said at the beginning that unfortunately it's cancer, so I was like stopping you and interrupting you. Well, so you're saying it's cancer, and then you got a little bit confused when I started asking, well, is this cancer or not cancer? It's because what I wanted to hear from you that it could be cancer, and we don't know the primary source, and we need to run some further tests to find out. Okay, so that's what I wanted
Yeah.
to hear from you, and then I would have moved on to the next talk. So at the very beginning, you can give me the possibilities. The possibilities
Mhm.
here, it could be a disease from the liver, it could be excessive fluid intake, it could be something as serious as cancer. All of these are possibilities, and we need to run some tests. One of the tests we've done is the fluid cytology, and unfortunately, there are some cancer cells. So that is suggestive that he might have cancer. We don't know just yet. We don't know what's the primary source, and I would like to run some further tests. All right.
Okay.
Okay, so the next point is actually talking about CT, all right? And they can even ask you this question. I would answer the question, but try to be a little bit sneaky. So the way you're gonna answer this question to say, well, so just to tell you about the whole process. So we've sent some sampling, as I said, and it's suggestive that it could be cancer. The next step will be doing some images, and after images, don't say the CT. The next step will be doing some images. After that, after we get there, and doing some blood tests as well, and some blood markers, and also making sure that he's comfortable and not short of breath and not in pain. So these are our management plan. And following this, after we have all the results, we would discuss the case in a multidisciplinary meeting to come up with a management plan. So usually the whole process takes up to 2 weeks until the case is discussed in a multidisciplinary meeting. So we have lots of time to sort all of these things out. Okay. So in the meantime, we're going to be doing the other test, making sure that his pain is well controlled, and also his shortness of breath is managed pretty well and looked into. And we would plan to get a CT scan maybe after the weekend, because unfortunately our CT scan is not currently working, and it will not be fixed until after the weekend. Right? So see what I'm getting at. So you're trying to,
Yeah.
you know, break it down to the patient in a very nice way and saying, well, we have lots of time, and it's actually true. You're not lying here. You have lots of time to get some blood tests to get to make sure he's comfortable in terms of his pain and respiration, and also doing the investigation on non-urgent cases. Okay, but the problem with that is, with what I just said, that the patient might just start by asking at the beginning, why does he need a CT scan? And when he said that, again, use the same answer. Well, that's a very good question. I'm going to answer it as a part of the whole management plan. How do you feel about discussing the whole management plan with you? And the CT scan, the answer to the CT scan will be included as well. All right. And then I start, we've run some tests, we get some imaging, and we discuss the management of his pain, the management of his, the shortness of breath, and then discussing the case in an MDT. The whole process takes up to 2 weeks, and the CT scan will be done at this time. All right. So try to be, a little bit sneaky in the way you're going to break it down to the patient. And Justin, if you start by saying, well, CT is broken, and then the patient is going to go into, well, what kind of hospital is this? You're not really doing anything to my father. And then you're going to say, well, it's actually not urgent. And when you say that, well, I'll be a little bit further annoyed, and then saying, well, what do you mean not urgent? I feel like that he's in pain, he's short of breath, so I feel like it's urgent. All right. So, but if you explain it this way and reassure me that the whole process takes up to 2 weeks to get everything sorted and discuss the case, well, I'll have to accept it. Okay. And then I think you answered all the rest quite well, but as separate questions. But if you give yourself like a minute to explain everything and how it's going to happen, that's going to save you lots of time, lots of hassle, lots of discussion with the patient. All right. Is there any, I mean, even after what I said, if the patient goes into, well, but I think CT scan might be needed urgently, well, you can explain, unfortunately, it's not really indicated at this point. However, I reassure you, if the condition gets any worse and we think it's indicated, we're going to have to do it, whether it's a transport or different hospital, or to do an alternative scan such as MRI or an ultrasound. Okay. In terms of the transfer, again, you're going to answer it the same way that I just did. And the questions like, what kind of cancer is it? The answer to it from you was quite adequate. You said that you don't know the answer, which is the right answer, really. We need to find out. We need to do further tests, and then we'll tell you. We'll update you after that. In terms of pain management, you mentioned shortness of breath. I wouldn't say. I know I tried to, ask you further question to get the answer from you. I wouldn't say that it is. We're going to do a therapeutic tap to relieve his shortness of breath. You don't really know that the pressure in the lung is what's causing the shortness of breath. It's one of the reasons, but it's not the exact reason, really. So you need to say, well, I haven't seen the patient yet. I would like to go and examine him and find out what is the cause. However, my impression that it could be the fluid accumulation in the stomach causing pressure in the lung. A therapeutic tap can be considered, which is aspirating some of the fluid in the abdomen to relieve the shortness of breath. All right. The question about telling his brother to come in, Um, I think the answer was quite okay. So you understand my worries, and you think it's wise to wait until we have the results and to make sure that it is confirmed or not confirmed. All right. Yeah. Thank you. Do you have any questions about this scenario? You're in clinic. You're one of the SHOs in the clinic, and you have a patient who's going for a total knee replacement on an elective basis, and they have a few questions for you. Um, would you like to please speak with them, if that's okay?
Yes.
Mhm.
Hello, I'm Dr. Nipuni, one of the surgical doctors that are looking after you. Can I confirm your name and your date of birth, please?
Yeah, hi, I'm Abdullah. I'm 56 years old.
I understand that you have some concerns regarding your knee surgery. Can you confirm what you know so far about your surgery?
Not much really. I don't know anything about what's going to happen really. I'm a bit concerned how long the surgery is going to last, and I would like to know further questions about the complications and whether there anything in particular to look for before the surgery, any medication that I need to stop, anything like that. So I actually have lots of questions, but why don't we start by maybe how long the surgery is it going to last?
Okay, so the operation usually takes less than 90 minutes, but it may take up to 2 hours with the anesthetic time and the preparation. And can I tell you about the complications now?
Uh, yeah, why not? What you can you tell me first, how is it done? How is it actually done, the total knee replacement?
Okay, so we're going to implant a metal mm, joint. I don't know what exactly. So we're going to cut through your bone, your muscles, and sometimes your nerves may even be damaged during this procedure. And we're going to implant a metal knee joint, and yeah, that's about it.
Yeah, so you're going to cut through are you going to fix that, or are you just going to leave it, cut?
Yeah, cut, replace the knee joint, and we're going to close you up and stitch it, and make sure you're okay after the surgery as well.
Yeah, okay, that's fine. So I can imagine if you're cutting through my muscles and cutting through the bone, there is lots of complication to that. Can you tell me more about this, if that's okay?
Yes. So the complications, so you may have a scar um, because we cut through the muscles and the bones and everything. And the biggest concern, I would say, is the bleeding. And also, there might be chances of infection, and you may have pain afterwards. And also, because you will be going under general anesthesia, there may be also anesthetic risks. And after the surgery, you may have like stiffness of the joint and even sometimes dislocation.
Hmm. This doesn't sound like a good decision to make, really. So you mentioned lots of risks about the surgery. Um,
Yeah,
can
so in
you tell
every
me,
case, we
are
will.
there any risks to them that are like unavoidable risks that's going to happen anyway? So does every patient who goes to the surgery bleed quite a lot? So I'm just worried
Um,
after what you
So, yes, this is a complication, but we will put you on blood thinning medication for the 14 days after the surgery,
Sorry,
and that
you
will
just said I
prevent
will be
your.
bleeding. Are you going to put me on blood thinning medication if I'm bleeding? Sorry, doctor, I'm a bit confused. I don't
Sorry,
really
sorry,
understand.
sorry, sorry. I'm sorry. We will giving you blood thinning medications to avoid blood clot formation. Wait, wait, I
Well, you didn't
messed up.
mention blood clot earlier. So is blood clot a risk factor as well of the operation?
Sorry.
So I don't really get it. You said that the major concern is bleeding, and now you're saying that you're going to give me blood thinning medication for the blood clot. I'm not sure if this makes sense to me.
Hello.
Can you hear me?
Yes. Yeah.
Did you hear what I just said?
No, no, I didn't. I lost
Yes,
connection, I
I was
guess.
saying that it doesn't make sense to me because you said the major concern is bleeding, and now you're saying that you're going to give me blood thinning medication for blood clot prevention. So I'm not really sure if that makes sense to me.
Yes. So during the procedure, you may have bleeding, and in that case, we will make sure that you are transfused. But after the surgery, you may have blood clot formation, and due to that, we will put you on blood thinning medication for the 14 days after surgery, because there
Okay,
is a possibility that you may get, yeah.
okay. And do I need to fast before the surgery?
Um, we recommend that you would stop eating 6 hours before the surgery, but you can take clear fluids up to 2 hours before the surgery.
Okay, and is it going to be under general or local anesthesia?
Um, it's going to be under general, so we're going to put you to sleep, and I will assure you that the anesthetist will come and speak to you before the surgery, and I will offer you a suitable anesthetic agent.
And
And
how long do I need to be patient
and
for?
this would, sorry,
How long do I need to be impatient for?
in
How long do I need to
what
be
I didn't
admitted?
understand.
How long do I need to be
Oh,
admitted?
um, okay. So if there are no complications, you would have to stay up to 3 days, but sometimes this may even longer. But before discharging you, we need to make sure that your pain is controlled and that you are mobilizing independently, that you can take the stairs. And we would have to make sure that you will be able to bend your knee, and we need to take off your bandage. Also, we will perform an X-ray to see if the surgery has gone well, and also you need to make sure that you are medically fit for discharge. And after all of this, we will discharge you. But usually, it will take up to 3 days if there are no complications.
All right. And do I need time off work as well?
Generally, I would tell you to stay away from work up to 7 days to 6 weeks, depending on how you're feeling. And also, if you do need a longer leave, your GP would be able to provide you with that.
Okay. Fine. And will I have a follow-up appointment?
Yes, after 4 to 6. No, sorry. I think after 6 weeks, you would the operating consultant would have
Why do
follow
I
up.
feel like that you're reading the answers? Are you reading the answers? Sorry to ask you this question, but I feel like you're
Yeah.
trying to correct yourself.
Yeah, I'm not very familiar with this case, so
I mean, it's fine if you, but you
it, it
don't
was
have
it,
to
is
read.
a, it was a little bit difficult for me. This one
Yeah,
particularly.
it's fine, but you don't really have to read the answers. We're obviously past the 9 minutes, so I'm gonna stop here. And ideally, from now on, you guys need to maybe open your cameras just to see how you're doing and see your facial expressions as well. All right, so that's fine. In terms of, we have lots of other questions. I'm going to answer them anyway, but just to go back, your introduction as well. Um, you've established background, but I think you know like the conversation, the way of the conversation is going, the pony is not really let's say bi-directional. It's not really a conversation. I feel like it was, and I'm sorry to say that, but I feel like it was a little bit robotic, in a sense that you were going question by question. I felt that you even was trying to read the screen here, and go to exactly with the same sequence. So the whole point of communication is to ignore what you know and have an interaction with a person, all right? So just try to make a conversation with me and provide me with the knowledge that you have. And it's okay to say that you don't have this knowledge and they would like to go and check, and you might let me know. All right. So just have a conversation with me. So the preparation time, you prepare for the exam for month and month and month, and when you go to the exam, you need to basically ignore the way that you were preparing and just have an interaction with the person, all right? So that's really a key here, okay? So, so you will start your conversation. So what do you know so far about your current condition, or what can you tell me what you know about the operation itself? And I will say, well, I don't know much about the operation really, but I have lots of questions about this and this and this and this. And then smiling and responding to that, and saying, well, that's absolutely fine. I'm very happy to answer all the questions, but how do you feel if we go through the operation itself, given that you said that you don't know much about the operation? So to be able to do the operation, so let me explain to you the knee joint itself. So the knee joint is formed between, and you can draw here. You will have a pencil, you will have a white piece of paper, you can draw to them. The knee joint is formed between a big bone in the thigh that's called the femur bone, which has lots of muscles around it, and two bones from the leg that's called the tibia and fibula. They're coming together, articulating in a gliding movement, which is called flexion and extension, or bending the knee and extending the knee. So basically, in your condition, you have a reason that we need to replace the knee joint, obviously because of the symptom that you had for a long time. And the way to do that, we're going to make it a small incision, a relatively long incision in front of your knee that's about 10 centimeters long, and then cut through the muscles, and of course we're going to fix them after that, and then cut through the bones and put a metal work inside that looks exactly like the knee, and you'll be able to get the same range of movement that you had when you were healthy. All right. So this is the operation. Are you following me so far? Do you understand what I said? Do you have any questions about this? And then you move forward to answer your question about the risks or the complication of the surgery. Obviously, it's an operation, so it comes with risks and benefits. And of course, I'm sure that you're aware of the benefits here, which is to relieve your pain and improve your walking or mobility as well. But it comes with risks. These risks, like I said, they're going to be like a scar that's measuring 10 centimeter. However, we'll close it quite nicely to make sure that it doesn't look, it's not an ugly scar, all right? Two, we'll cut through the muscles. We might by mistake injure a nerve, and this will lead to loss of sensation. However, it doesn't happen very often. We might injure a blood vessel. It can lead to bleeding, but usually we'll be able to treat that either by coagulating it or transfusing you with blood if needed. And let me ask you, do you have any problem with having blood transfusion? And they will say no. The other issues could be a failure of the prosthesis or an infection, which actually a major risk, but we give you antibiotic just before the operation. And if this happened and worse come to worse, sometimes we have to take out the metal work to treat you if you got an infection. And the risk of that is less than 15%. Still quite high, but the risk is there. All right. And then you mentioned after the operation, you'll be inpatient for a few days, and it will do some physiotherapy for you. We're also going to put you on a blood thinning medication to thin your blood, and this is basically to prevent having blood clot. And the reason why having a major surgery in your lower limbs and being bedridden for a few days or unable to walk does increase the risk of having a blood clot, and we treat that by giving you blood thinning medication. This, in addition to the risk of anesthetics, and that will be discussed with you by the anesthetic lead. All right. To see what I'm doing here, I know I spoke a lot. I took like 2 minutes explaining the risk, which is absolutely fine. You have 9 minutes, and you'll be able to finish in those 9 minutes. Yeah, you know what I'm doing here? I explained the risks, but not just mentioning the risks. I explained the risks and the solution to each risk. Right? So I said, you might have bleeding, but we're going to coagulate it and give you blood transfusion. So we have a solution to it. Right? You might have infection, but we're going to give you antibiotic. And if it's happened, we're going to give you further antibiotic and might take the prosthesis out. You might have a blood clot, but we're going to give you blood thinning medication and get the physiotherapy to see you. All right? So you will have a scar, but we'll close it nicely. So you try to reassure the patient with each risk that we do have a solution for that. And if there is any unavoidable risk, you will have to mention it anyway and say that this is unavoidable. All right? The blood clot prevention, it's important to mention here. He asked you next question, are you going to give me a blood clot prevention? Or you mentioned it briefly as well. You will say, yes, that's an excellent question. Thanks for bringing this up. There are two factors that will help us avoid the blood clots. And one is to keep you hydrated and mobilized as soon as possible. Two, giving you a blood thinning medication to thin your blood. It's very important to have these two things given because if you had a blood clot, it might go to the lung. And if it goes to the lung, it's actually a problem and might lead to something as serious as death. So here, again, you mentioned death as a risk, which is actually a risk of any operation, basically. All right. So the next bit is, do I need to fast prior surgery? You answered it pretty well. Is this going to be under general anesthesia? You said yes, under general anesthesia. That's not true, right? It can be general, can be spinal anesthesia. So you want to say it's one of the options. My anesthetic colleague is going to discuss with you in further detail, but it can be general and it can be spinal anesthesia as well. How long do I need to be admitted for? You will give a very vague answer here. That's the right answer. Very vague answer. So you will say most of the patients will need to stay in for a few days after the operation to take them off for a few things. One, we need to control the pain, making sure the knee is being flexed up to 90 degrees, making sure they're independently mobile, and the physiotherapy are happy with their progress. We got their post-operative X-ray and the bandage taken off, and making sure they're medically fit for the discharge. As soon as we sign you off for that, you'll be able to go home. This can take up to 3 days, but it varies quite a lot in multiple patients, and sometimes patients have to stay for a month if they had any complication from the surgery. All right, so you give a very, very vague answer, and this is the right thing. Will I have follow-up appointment? Every patient in the NHS basically will have a follow-up appointment in 6 weeks. If you don't know the answer, 6 weeks is the right answer. All right. So it's not that you don't know. Mostly, every patient, if you say we're going to follow up in 6 weeks, it's going to be the right answer with basically any condition, right? But of course, if you know the specific answer to each condition, that would be great. In this case, yes, we'll follow the patient up in 6 weeks. Do I need time of work? It's actually a good point to start asking them, what do you do for a living? Oh, yeah, of course, we can give you some time off, but can you tell me what you do for a living? So you're having a human interaction here. What do you do for a living? And they will say, well, I work in an office. I don't really do much any activities and so on. You will say, well, ideally, you should be at home in a comfortable environment for a few weeks, and you can have a phased return to work that can take maybe up to 4 to 6 weeks. We can issue you with 1 week, and then if you need further further relief or further time off, you can ask your GP to sign you off for that. Will I be expected to start walking first day after surgery, right? Will I be able to swim? Ideally, it's not recommended for up to maybe 6 weeks after the operation to make sure the wound is completely healed. Will I be able to drive? Yes, you can be able to drive when you feel comfortable. You don't need to inform the DVLA, but I would give it for 6 weeks until you feel comfortable or confident in your feet. Will I be able to fly? It's not recommended for 6 weeks, given the risk of having blood clots. All right. Okay. So these are the communication here in terms of total knee replacement. Like I said, the take message from here is take your time explaining the procedure, take your time explaining the risks, combine the risks and the solution for each risk, and that will save you lots of time in handling the scenario. All right. Nipuni, do you have any question?
Yes, sir. So when it comes to closure, where do we do that? Do we do it with the patient, or do we have to go
Yeah.
to
You,
a different
you don't have to speak
examiner?
with anyone. No, you don't. For the communication, you don't really speak with the examiner at all, right? You only speak with the patient. You don't speak with the examiner at all. You finish your scenario, you move on to the next scenario, all right? So the closure is with the patient. So you will say to them, all right, so let me summarize. We'll talk today about the operation itself and the risks and benefits and how to treat the risks, and also giving you blood thinning medication after the operation. How long are you going to stay? And you don't have any further questions for me, do you? That's it, all right? And you can give them, of course, the information leaflet about the operation itself, all right?
All right.
You have a patient who's admitted with recurrent hernia, inguinal hernia, and he's legally blind, walking stick and dark glasses from cataract, and patient had mechanical heart valve replacement and is on warfarin. and is planned for an operation, and he was asked to stop his warfarin. However, the patient is quite worried because he was told before never to stop this medication, and it's crucial to him. Would you like to discuss with patient that? That's okay.
Okay. Good morning. I am Dr. Ali, one of the exam candidates. Could I confirm your name and age, please?
Hi, Dr. I'm Abdullah here. I'm 55.
Okay, nice to meet you, Abdullah. Today, I would like to discuss you about your blood thinner that you use. Can you tell me first what do you know so far about your condition?
Well, I know everything about my condition, really, doctor. I'm quite confident and uncomfortable with taking that medication. So I've been taking warfarin for years and years now because I have a mechanical valve that was inserted years ago. And since I've been taking this, since I had the mechanical valve replacement, and I was told never to stop this medication, and if I ever do, I will be at a higher risk of having a stroke and maybe a blood clot as well. And I don't want to have that. So I was told by one of your colleagues to stop the medication, and I'm not really convinced that this is the right advice for me, given that I have a mechanical valve and I'm at a higher risk of having blood clots.
Yes, that's right. Blood thinner, like the one that you use, it's used to prevent the blood clot formations, which can harm the patients in many ways. We can offer for that in surgery. In surgery, the bleedings can result as complications in patients who has used blood thinner, but we can handle that and optimize the blood thinning effect of the drugs, and in the same times that we prevent the clot formations. We can stop that drugs and give you alternative drugs that we can control it, because the one that you take it can be associated with more bleedings that is difficult to control. After operations, we can we can you can return back to your usual medications after you can take oral intake, and we are satisfied with your wound.
Well, yeah. Well, doctor, I'm not sure if this is convincing to me, really. So basically, you said that I will have to be off this medication to avoid me bleeding during the surgery, but you're gonna put me on a different medication that's again a blood thinning medication. So I don't really get it. What's the actual difference between them?
Yes, the actual difference is that the alternative will be able to be controlled and controlled I mean the bleedings controlled with the alternatives. And after surgery, you can go back to your usual medications once you are able to take oral intake.
Yeah. All right. So you said I'm gonna go back to warfarin after the operation.
Yes.
And when is that? Is it first day after the operation?
Well, it depends on type of surgery and the ability of the patients to take oral intake. Once the patients will take oral intake, we will start your usual medications. We will also continue our alternatives until we check the specific test that used to monitor the bleeding tendency and the effect of the blood thinner. Once it's in a target range, we will stop our alternative and you can continue your own blood thinner drug.
Okay. Fine. Okay, thank you. So yeah, I think you're still behind the 9 minutes. But to be honest, Ali, I'm not very happy with the explanation that you made. I'm going to give you a bit of advice. That is, when is your exam, by the way?
26th of April.
This April, right? So in 26 days, or maybe
Yes.
23 days. Okay, that's fine. So Ali, I do understand and I do appreciate that the English is not a first language for you, which makes it a little bit tricky to explain things. I was in the same situation years ago. So I would say what you need to do is to actually start writing the answers, right? So just try to write the answer and read it, or even record to yourself and see if this is an adequate explanation for you. I felt like you were taking longer time to explain things, and at the end, the explanation was not really adequate. Okay, so for example, I told you I'm currently in warfarin, and I was asked to stop, and I'm not really convinced that this is the right thing. So first of all, you need to acknowledge what I'm saying. Just say, I do understand what you're saying, and I understand, especially in patients with mechanical valve, warfarin is extremely important medication. But here we have a different scenario. I will not taking warfarin off you forever. So let me explain to you, and then start explaining nicely what's actually happening. So start by talking, okay, so first let's talk about warfarin. It's a blood thinning medication, like you said. It does increase risk of bleeding, and having surgery will even further increase the risk of bleeding. All right. So, and something to know about warfarin, which I'm sure that you might know, is the half-life of warfarin that lasts in the body is about 3 days. So it's a very difficult medication to reverse, to make sure that you're having a standard risk of bleeding just before the surgery. So what we're going to do is, just 5 days before the surgery, we're going to stop the warfarin and put you on a different medication that has less half-life of 6 to 12 hours. So it will be easy to have an operation in a safer window for you with a lower risk of bleeding, right? So you're trying to break it down into pieces. One, let's talk about warfarin. And I'm going to mention 2 things about warfarin. It's a blood thinning medication with prolonged half-life, about 3 days. Okay. 2, let's talk about the alternative. You kept saying the alternative, but you never actually meant it. You never actually said it, right? So the alternative is a low molecular weight heparin, which is a small injection in your tummy, right? And the half-life of that medication is 6 to 12 hours. So it's good that we can reverse it easily, and we can have an operation in a safer window. All right. That's the first bit, that you need to make your communication clear. Try to signpost. Don't be monotonous. Try to say, like in the important bits, try even to use your hand gestures. So let's first talk about warfarin. And I'm going to mention 2 things. It's a blood thinning medication, and it has a prolonged half-life that lasts up to 3 days. And this makes it very tricky to control the bleeding during surgery if you are on warfarin. So we'll have to be off warfarin for at least 3 to 5 days. Okay, and then the other medication is low molecular weight heparin, injection through your tummy with half-life of 12 hours, etc., etc. Okay, that's how to explain this bit. All right, what's the difference between the medication? I mean, I asked you very clearly what's the difference, and they still didn't get it at the end. So you want to say the half-life. This medication, it takes the body about 3 to 5 days to clear, and this medication, it takes the body 12 or 6 to 12 hours to clear. This is what you want to say. Will you start me later on a warfarin? Yes, by all means, you have to be on warfarin. Like I said, it's a crucial medication for patients with metallic valve replacement. So yeah, you will have to be on it. We're going to start you as soon as you're able to eat and drink after the surgery. All right. So usually will be 2 to 3 days. You can here mention the bridging as well, because you will have to keep them on the low molecular weight heparin for 3 days until the warfarin, the bridging is done. Right. So you can mention it here. Yeah, after the operation, you will be in warfarin. You will take it as soon as you're able to eat and drink. However, you will have to continue on low molecular, on the injections in your tummy, because it takes the warfarin 3 days to build up in your blood and increase to a level that's able to actually thin your blood. Right? When you say that is done, scenario is done, I wouldn't ask you any further questions. Okay? So I do understand here what the difficulties for an international graduate that's the English is not first language. I'm one myself that I've faced that before. So what I'm trying to say is take your time in writing the answers. But that really helps, or recording to yourself and listen to yourself and see what you're saying, if it's sort of clear or not clear. All right, it might be a lot of work, but if you don't do that, your communication in the exam will be very tricky. And communication in the exam is extremely important because it's not only 2 scenarios, it's about 15 scenarios. All right, and what I mean by that is your communication is being assessed in pathology and acute care and history taking and everything, right? So you want to make sure that your communication is very, very clear.
Okay, you are a senior house officer on call for emergency general surgery admission. A 10-year-old girl has just been admitted as an emergency with peritonitis. She has been unwell for 2 days and very unwell for 1. The child is extremely ill. A perforated appendix is suspected and she is being resuscitated by a registrar before being taken to the operating theatre. Your consultant, Mr. X, is on his way from home and will perform the operation. You have been instructed to see the child's father and explain the situation. You do not have an opportunity to see the child before she was taken to theatre. Okay.
Yeah. So Christopher, let me just say something to you. So, did you watch the lecture or not?
Unfortunately, I was working yesterday, late last night, and it's very early by me. I wasn't able to look at the lecture.
Not to worry at all, not at all. So basically, what I want to say is, you need to, like I said, even in the lecture and also in the lecture as well, you need to memorize the scenario, or at least know it very well. Okay, so that will make it very easy for you in the exam.
Right.
In the exam, you will not have this much of information written to you in a stem. You will have a single line saying discuss with father. All right, and then you will have to read and find out about this information. All right.
Right.
But basically, that's fine. I think you'll be able to do well anyway. So let's go and start. Start when you're ready, okay?
Okay, yeah, sure. Good morning, sir. My name is Dr. Bufong, and I'm one of the senior house officers at the facility. I understand that you are the parent of this patient. Can I confirm your name and yes? Can I confirm your
Hi, I'm Abdullah here. I'm the father of Leslie, and I'm just quite worried, really, doctor. I feel really guilty. I feel that it's purely my mistake. This morning I left her and went to work, and she was in pain. So I'm just quite worried about her. Are you able to update me if that's okay?
Sure, sir. I want to just assure you that I will try to explain what's going on, and I hope that at the end you will feel a bit more comfortable. It's okay to be concerned, but I hope you don't feel too worried. All right. So can you explain to me what you know about your daughter's situation at this point in time?
Well, all I know that I was told this morning that she had severe abdominal pain and she had to attend to the A&E and understand that she's going for surgery. And I feel that I'm the reason why she's going for surgery because I left her this morning.
Okay. Well, okay. So by chance, do you remember for what period of time you thought she was ill for?
Well, last night she started to sort of complain of tummy pain, um, but it wasn't bad enough that we would go and seek medical. But we just thought that it's the normal pain that she gets after she eats.
Okay.
But yeah, so that was
Okay.
the first time she complained of that.
Right, no problem. Well, the thing about it is that for your daughter or for children, having abdominal pain, especially if they feel unwell, can be a very concerning medical problem. And essentially, based on our investigations, most likely we are suspecting that your daughter's having an inflamed appendix. And how we deal with this problem is via surgical management, where we would want to remove her appendix in order to improve her overall medical condition and potentially prevent her from suffering from a life-threatening condition, what we call sepsis. Okay? By chance, have you ever heard about an appendicitis before?
Well, I know what appendicitis is, but unfortunately, my father had appendicitis and an abscess recently, and he died. So that makes actually me very worried about the operation now. But
Okay.
can you tell me, is it definitely appendicitis in her condition?
Well, at, at this point in time, I haven't seen the patient myself. My senior registrar, he's currently with your daughter, and he's currently stabilizing her, ensuring that she is healthy and fine and fit for the operation. But based on the discussions with my consultant as well, they highly suspect that she's having an appendicitis. And with regards to how overall management and treatment, they would want to physically examine the appendicitis, and if they realize that it's inflamed or infected, they'd want to remove that source of infection, which potentially would be the inflamed appendix.
Okay. Fine. So we don't know yet. Fine, but you're basically doing it to diagnose it. I do understand that, but what are the risks of the surgery itself?
See, can you repeat your question again?
What are the risks of the surgery?
Okay, so there are many risks involved in this procedure. Okay, one of the risks is that, one, for sure, she's going to have a cosmetic scar on her tummy. I can assure you that this scar is going to be, we're going to try to make the scars as small of a defect as possible. Okay, now accessing the layers of the tummy, there can be some bleeding, right? Based on the procedure, if there's any bleeding, we will be able to address the bleeding and ensure that, it's not persistent. Okay. Also, there can be damage to the bowel in inspecting the large and the small intestines as well. Right. If this happens, it can be surgically managed as well. There's also a risk that if there is an infection, the infection can spread. However, we'll be covering her with antibiotics. And these are the major risks of the procedure. Also, there may be some anesthetic risks as well. However, the anesthetist, I can assure you that they may have a discussion with you and address any potential red flags. And also, there's a very small risk that the procedure can fail. However, it is my consultant who's a very experienced surgeon doing the procedure, and I can assure you that he's competent in ensuring that your daughter can do.
What's the consultant name?
The consultant's name is Mr. X. All right. Now, once you're hearing me, sir?
Can you say again, what's the consultant name?
The consultant's name is Mr. X.
Okay. Well, I'm quite worried now, really, because I remember that consultant operated on my father 3 months ago, and my father died from the operation, really.
Right.
He had a perfect, and I'm quite worried.
Well. So the thing about it is that this is a case by case scenario. The presentation and the comorbidities or the risk factors for everyone coming to surgery is different, and I'm not sure potentially what may have been your father's risk factors, right? I can also say that I'm not sure what are your daughter's risk factors as well. What I will say is that at this point in time, your daughter, she is currently in a life-threatening situation where, if the procedure is not done, there's a risk that she can become septic and she can die. So this operation is really to assist in saving her life.
Yeah, I'm not objecting to the operation, of course. By all means, the operation needs to happen, and I totally support that. But I'm just worried about that particular consultant. Are we able to change the consultant for me?
Well, so unfortunately, at this time, I am not sure of any other consultant that may be available to assist your daughter in this specific moment in time. what I could assure you of is that, this doctor is a consultant and he is very well capable of, doing this procedure. And if there are any problems that need to be addressed, I'm pretty sure that we will be able to address. And most likely your daughter will be able to be successful in coming through the surgery. At the end of the procedure, we would want to monitor your daughter, ensure that all of her vital signs are under control, and we would want to monitor her progress.
Okay, that's
So,
fine. Will she be able to
yes.
get pregnant again?
Well, at this point in time, I would not be able to say no. Your daughter. You asked if will she be able to get pregnant? Yes.
Yeah.
Okay. Well, so during the operation, there may be a risk that there could be damage to the ovaries and the fallopian tubes. However, based on the location of these structures, the risk of damaging these structures are low. So I'm not ruling out entirely that yes, I'm not saying that yes for sure you're going to be able to become pregnant. However, what I'm saying is that this is a very low risk, and even though it's a very important concern, I don't think that you should worry too much.
Well, I'm not worried too much. I'm just, adequately worried, let's say.
Yes.
Yeah, that's fine. Okay, thank you, doctor.
Sure. Well, it was nice having a chat with you. Just to summarize, it's just for you to understand that your daughter is not well. Okay. Based on our assessment of her, she has an inflammatory slash infectious process in the tummy area, and we think that solving this problem would be via surgical management, and we're suspecting that she's having an inflamed appendix. Okay. And if we don't do this procedure, she can develop sepsis and potentially die. Are you okay and understand everything that we would have discussed
Yeah,
today?
we can go ahead and consent. Am I able to consent for her?
Definitely, yes, you would be able to consent for her. Yes.
Okay, that's fine. I know this is not going to be part of the exam, but what type of consent are you going to make for this patient?
Pardon?
What type of consent are you going to do for this patient?
Um, I honestly, I don't know the name of the consent.
How many types of consent that you know? Do you know any type of the consents?
I know there are four types of consents.
Mm-hmm.
I know that there is one consent where it's done by the two consultants.
No, not necessarily. Does anyone know the answer to that? What type of consent are you going to use for pediatrics?
Jehovah consent?
Can you say again? I didn't hear you.
Jehovah consent?
No, sorry, I didn't get that. Can you say again, please, slowly?
Jehovah's consent.
No, Jehovah's consent. No, not at all. Why would you do Jehovah's here? Jehovah's is basically for those patients who refuse to take blood transfusion. Anyone know the answer? So Bav is around. Bav, you work in the NHS, don't you?
Sorry, I'm driving. Just one.
Okay, that's fine. No worries. Okay, fine. Right.
Yes.
So basically, we have four types of consents, right? Four types of consents. Consent type 1 is for adults who have capacity. Okay. Consent type 4
Is
for.
consent 2, is it normally for children?
Can I say again?
Is that consent form 2 for children?
Correct. Yeah, you're gonna do consent form 2. Consent form 4 is for adults and youngs who don't have capacity, or basically unconscious or confused and unable to sign and unable to understand or weigh the options. So type 1 for those who have capacity, for adults who have capacity, and type 2, type 4 is for those who don't have capacity, and type 2 is for children. Okay, and it needs to be signed by those who have, basically their mother or whoever is in a parenthood responsibility, starting by their mother first, and their father will be next. Okay. And then consent form 3 is basically for children or adults that do have capacity. So children, if you have a child, 14 years old, but they have capacity, they can sign a consent form 3. Okay. Fine. I mean, obviously, this is not part of this scenario, but can be asked somewhere else. I think it can be asked in the procedures. You know, the scenario for in the procedures in arranging the theater list. You can be asked to define a consent. What is a consent? What are the types that you know, and what are the differences between them? So you need to know that. Okay. Fine. So, Christopher, what do you think of your performance in this scenario?
It was a little bit difficult. I just need to familiarize myself with the actual scenario and practice.
Yeah, I think so. So in terms of your introduction, it was okay. It was a little bit slow though, so I would go into it directly, very quick. You know what's happening, so just go directly into it. The thing is, which I mentioned like twice or 3 times, I kept saying I feel really guilty. I'm the main reason. So at least you need to acknowledge this and sort of you know, reassure me that I shouldn't be feeling guilty. So basically, you would say, well, I appreciate that you're worried about your daughter, and do understand that you do feel guilty about this, but I don't think that you were any reason to cause her appendicitis. Most of the times, we don't know the exact reason, and it's very common at this age group. And of course, we don't know yet if it's confirmed or not. So I would advise you not to feel guilty, as you're not really a particular reason for this condition. And the other side, she's currently in safe hands, will be able to operate and get her sorted, right? That's one thing. Is it definitely appendicitis? Your answer needs to be clear cut here. If you keep, you know, circling around, you're not going to really take the mark. You want to make it very clear. You say, I wouldn't say definitely, but it's likely appendicitis. So it's one of the difficult diagnoses to confirm, but we look at many factors. 1, it's common in this age. 2, the presentation is somehow typical. 3, we can't really tell that it's definite until we do the operation and actually have the appendix out and see that it's actually inflamed. All right. What are the risks of the operation? I think you've done the combination here, which is good, but you need to signpost me. All right. You need to basically, like I said, use your voice to stress in certain points and ignore certain points if you wish. All right. So you want to say there are the risks of this operation. Of course, it's an operation, so it carries risks and benefits. There are going to be some small scars. This could be 3 tiny scars, each measuring about a few centimeters, like 1 to 2 centimeters. 2, there is risk of this. I mean, just use your voice to sort of point out what's the actual risks. I want to like end the consultation and your patient actually remembers the risks of this operation. Okay. So you want to take your time doing that. There will be 3 small scars. Will she be able to get pregnant? Again, your answer here, you kept fiddling around. You didn't give me a clear answer. So you want to say, well, this is a very important point that you just mentioned. And thank you for bringing this up. Infection might lead to adhesions between the tube, and it can lead to something called subfertility. And subfertility is basically, there is a risk later on that she can be infertile, but we wouldn't know this, wouldn't be able to quantify the risk just yet. And I would advise that we just deal with each step, one step at a time. All right. The other thing, you don't have to say things like you don't have to worry about it too much, all right? Because it's a patient, it's a family, it's their daughter. They can worry the way they want. Your job here, not to tell them off for worrying about the patient, but basically to give them the right information and to reassure them, right? So saying to someone you don't have to worry too much is not really okay. Boom, I'm not worried after you say that. No, that's not going to happen. So just as a doctor, you need to give me the right information, and it's my decision whether to worry or not as a patient. Okay. That's one thing. The other thing is, when I talked about the consultant, I felt you were a little bit defensive for non-obvious reasons for me. So when I said, well, this consultant operated on my father, and my father died, so I feel like the main reason. All right. So first of all, you don't want to get into that, right? It's not part of your job to get into that. But one, you need to show compassion. Okay. So you need to say, first of all, I'm really sorry about your father and what you've been through. It must be really tough that this happened only 3 months ago. And I hope that you're able to cope with that. And if there's any help that we can offer, we're very happy to. However, I'm afraid I'm unable to comment on this. I was not involved in your father care, and I'm not really sure what are the circumstances of that scenario. That's the second thing. The third thing, the third thing, I felt that you were very comfortable making a decision on your own, which actually shouldn't be the case. So I think you should have said that I'm very happy I feel that my consultant will be able to answer your question better than me in terms of this operation. So I'm very happy for them to ask them to speak with you. But there is another factor that we need to consider, that this actually might delay things. And at certain point, if we think your condition is getting worse, we'll have to go ahead and do the operation anyway for her best interest, because this is a major concern that some might get into sepsis. And in terms of the discussion with the consultant, it can happen anytime, either before or after the operation. Changing the consultant, again, you were very comfortable saying, well, no, we're not going to change the consultant because I don't think there is anyone around. I think you can, right? But what you need to do is you want to say, well, there is my information that there is only this consultant in today, but I'm very happy to speak with him and ask him if he's able to do that. But of course, like I said, this is going to take longer time and can jeopardize her life. And at some point, if her condition gets worse, we'll have to go ahead and do the operation anyway, either with or without their consent, right? So when you're doing for consent type 2, like you mentioned, if the family are not in agreement, and you feel that they're not making a sound decision and you have any concern, it will be the consultant or the medical team decision, right? And they will sign a different consent for the child. Patient, a son with a splenic rupture, all right? And father approved an operation. Let's do it the other way around. So mother approved the operation and father appears late, crying, and demands to speak to a consultant. And you are the one available to speak with them. Do you know the scenario or not?
Yes, I know. Yeah.
Okay, go on. You're free to start when you're ready.
Yes. I'll start now.
Yeah.
All right. Hi, I'm Dr. Atwal, one of the surgical doctors taking care of your child. Can I confirm your name and your relationship with the child, please?
Oh, hi, I'm Abdullah here. I'm the father.
No, is it not with the mother?
Let's make it the father then.
All right, all right.
Yeah.
Okay. So I've been asked to come and talk about the condition of your child, and I'll be answering all the queries that you have in your mind regarding your child. First of all, I would like to know, what do you know about the condition of your child?
Well, doctor, I'm very disappointed, really. I know that he had some splenic injury, but I do understand that you're taking him to theater without actually consulting me or taking my opinion, or involving me in the care. So I'm not really sure why you're doing that without coming back to me first before moving on to surgery.
All right, I'll answer all your queries, but before that, I would like to know, do you have any idea what actually happened?
I know that he was playing in the backyard, and he was in the trampoline and fell down and hit his spleen, the side of his body on the left side, and there is I know that he has like a small blood on his spleen that might need an operation. That's my understanding.
All right. So, Mr. Abdullah, I'll explain this to you. So, when your child came and we did an investigation, there is an organ inside the tummy on the left side, which is called spleen, as you have told, which is a very vascular structure. That means it is rich in blood supply, and there was an injury to it, leading to leading to blood loss, and I would say that it is an emergency and that needed to be done as soon as possible. And we had to take your child to operation theater. That was for his best interest. As the father was with the child, it was done. It was informed everything to him and was done under his consent.
Okay, that's fine. Well, yeah, I see. But is it a serious thing?
I'm sorry to tell you that yes, it is a serious thing as of now because the bleeding can worsen and we need to control it as soon as possible to decrease the worse outcomes.
Okay. Am I able to see him now?
I'm sorry, but we won't be able to let you see him as of now because the baby is in the operation theater. But once he's out of the operation theater, you'll be updated about it, and you can just meet the child. Yeah.
Are there any risks from the surgery?
Yes, that's a very good question. Like any other surgery, we do have risks and benefits. The benefit I would like to tell you first because this is an emergency surgery and I would say a life saving surgery, and we need to do it as soon as possible to control the bleeding. Like any other surgery, there are risks too that can lead to further bleeding, the infection. This is inside the abdomen, so there can be injury to any other abdominal organ. There can be infection, but we will take care of the infection as we're going to give the antibiotics. If there is any trauma to any other part of the abdomen, we're going to take care of that too. Is that can be dealt with? Yeah.
All right, that's fine. Okay, thank you.
Also, I would like you to know that I would like to ask you a few questions regarding the safeguarding of your child. Can I ask you where were you at the time of the incident?
I wasn't. I was at work at that time, so I don't really know what happened. But I was told by his mother that he fell down from the trampoline.
Mm-hmm. So this is like nothing of like concern as of now, but as a safeguarding team, we have to inform them about the situation in order to have a safe environment for the child at home, and they might visit you and ask few questions regarding the incident. You don't need to worry about this, but yes, it needs to be taken care of.
All right, that's fine. You can do that. But the situation at home is quite stable, and there isn't anything that I would worry about.
All right. Any other questions you would like to ask, Mr. Abdullah?
No, that's it. Thank you very much.
Thank you. Thank you so much.
A relatively short scenario, but if you do the right things quite early, it will be even shorter, really. So, what do you think? Anything to improve? Anything that gone well? Amma?
No, I don't know.
What do you mean you don't know? You need to know that because this is the only way you will improve in terms of communication. So, what do you think of your performance in this one? Did you do well?
It was okay, I think.
Yeah, it was alright. It wasn't too bad. But in terms of maybe things to improve, I think in your the risks of the surgery, again, you need to do the combination a little bit more than this, and you need to mention a little bit more risks as well. And you need to explain the way you're going to do the operation. So you can say this can be done laparoscopically or open surgery. Open surgery means there's going to be a incision, whether in the midline of the abdomen, in the middle part of the abdomen, right there. To access the spleen, there is a higher risk of bleeding, especially that the patient has bleeding already. It can be challenging to deal with, but what we can do, we can transfuse them with blood, and we can also um, sort of do the hemostasis and stop the bleeding. But it can be tricky at certain points, especially in this patient. You're worried about this, and the bleeding is a very high risk. There is risk of infection. There is a long-term risk of patient needing to be long-term antibiotic, and also the vaccination. You need to mention that. It's quite crucial for them to know that they will need to be on long-term antibiotic for life, basically, because they will be at higher risk of having infection. And you want to mention as well, if they had a splenectomy, you want to mention as well the other risks, standard risk of having a scar and having nerve injury and having muscle injury. and having other internal organ injury, such as the bowel perforation, and the intra-abdominal sepsis, or having sepsis after the surgery, having blood clots is very low risk, but can happen. And right. Right, so you want to do that, and also you want to mention. So these are the risks. Is it serious? Yeah, you want to explain. You said clearly that yes, this is a serious condition. And when I started, why didn't you speak with me before the surgery? I think you need to be a little bit more quiet when you're answering this question. You want to reassure them, I do understand your concern, but in certain scenarios, like your daughter scenario or your son scenario, it was a little bit tricky in terms of the situation. They were very unwell, and we had to take them to theater urgently for their best interest. And we also discussed with your wife and or your husband, whatever, and they were in agreement to go to surgery. But in these scenarios anyway, if we have a child who's very unwell, we need to act for their best interest. And family, of course, will be involved in the decision, whether before, during, or after the operation, but we need to act quite urgently. All right. So when you say that, I think any father or any family will actually appreciate what you've done, rather than telling you off for taking the patient to theater without consulting them. All right. Okay. The last question. Well, I should have asked you when will he be discharged, but that's fine. You cannot really tell me the exact date. I asked you as well if I can see them now. You can just reassure me and say, of course you can see them, but unfortunately that will not be now. They're currently in theater, but I promise you, as soon as they are out of theater, I will look into it and arrange a time for you to see them. All right. But yeah, generally that's a quite short scenario, not very long, and it was done nicely. All right.
Hello, I'm Dr. Nikuni, one of the surgical doctors. Can I start by confirming your name and date of birth?
Oh, hi, I'm Abdullah. I'm 59 years old.
Okay, so I am here to get the consent for the colonoscopy, or it is a camera test that we are trying to arrange for you. Have you ever done a colonoscopy before?
No, really, I have never had this operation before, and I'm actually a little bit worried. Can you explain to me a little bit more? What does it actually include?
Okay, so this is a camera test. What we're going to do is that we're going to take an instrument, such as an endoscope, which has a camera in it, and we are going to pass it from your anus, and we're going to look inside of your bowels to see if there is any abnormalities. And this should not be painful, but we will be giving you sedatives, and this would make you a little drowsy. And also, we will give you some laxatives before the procedure, so that we will be able to better visualize what is going on. And it is important that you take them before the procedure. All right.
Okay, that's fine. Well, yeah, that's okay. But I'm not sure how I feel about this. Is there any alternative for this procedure at all?
Yes, there is an alternative. This is known as a barium enema, which is when we insert a contrast for your back, and we would take some pictures. But this, of course, has some limitations. We cannot be sure of the accuracy, and also we won't be sure if we would get necessary samples that we need.
Okay. That's fine. What are the risks of this? Are you able to explain me the risks of having colonoscopy?
In the case of a colonoscopy, we can have risks such as bleeding and infection, but this is very not very usual, and also this would happen if there is any sort of perforation during the procedure, but you don't have to worry too much about that.
Okay. Well, do I need to be fasting before the procedure?
Yes, it is necessary for you to avoid eating high carbohydrate, high carb meals, and also to avoid eating heavy meals. And it is important that you would eat rather light, fiber like food, and also drink enough water and fluids so that we would be able to see your bowel better clearly during the procedure.
All right, that's fine. And do I need to stop any medication before the surgery?
If you are taking any type of blood thinning medication, such as aspirin or Colpi, then you might have to stop it about 3 days before the surgery, because, as I mentioned, a complication could be bleeding. So it is necessary it would be better if you can stop them. Other than that, that's all. You can take your other medications.
All right. When will I have the results of this operation or this procedure?
You would be meeting with your consultant after 2 weeks after the procedure, and during this time, your consultant will talk to you about the results.
Yeah, okay. All right, can you tell me more about my bowel preparation as well? What I'm going to do in terms of the preparation?
So you the before 4 days, you need to stop taking irons or other constipating drugs or any bulking agents. And in 2 days prior, it would be good if you would eat food which is like eggs, cheese, but it would be better if you wouldn't eat heavy food like meats and fish or fruits and vegetables. And 1 day before, you can have breakfast with the above mentioned ones, which are like the eggs, the cheese, and the bread, but only take clear fluids, and so take enough water, like 2 glasses of water after in the morning. And on the day of the procedure, I would recommend that you do not eat.
Yeah, that's fine. Yeah, I think you've done very well in that one, really. You answered all the questions adequately. Yeah, to be honest, I don't have much comments for you. Maybe just the risks. You can just mention a little bit more, and again, do the combination sort of things instead of just enumerating the risks.
Mhm.
Yeah, well done on this one. Okay. Any questions?